Hi guys. So in this video we'll be talking about different kinds of tests, hearing tests done in children. All these hearing tests, which hearing test you have to choose depends on the age of the child. So what are the indications of hearing test first of all? So when any parent is concerned about their child's hearings, like for example they come to you and tell you that the child is hearing, watching TV with a high volume, or if he's not able to respond, there is no response when somebody is calling out his name, or when he's not paying attention in class, or any such scenario, or any kind of concern that the parent has, he would come to you and ask you about the child's hearing. You can do you can do these hearing tests. The next one would be bacterial meningitis, because the most common complication of meningitis in children would be hearing loss. All right. And temporal bone fracture, because that's where your ear lies. And kernicterus is nothing but jaundice, or increased bilirubin in your brain. And delayed milestones, because the patient might have any kind of delayed development. So to remember what age the patient has to undergo what kind of test, I gave this small mnemonic. This is a Hindi mnemonic. All right. So just know that the age we are gonna see it as this way: less than 6 months, then 6 months to 2 years, 2 to 4 years, and greater than 4 years. All right. So it's all 4E. So less than 6, 6 2, 6 minus 2 is 4, 2 4 again 4 years, and greater than 4 years. All right. So abe oe, that is when you're calling out to somebody. Distract or discriminate. Don't distract and don't discriminate. मत कर. Okay. अगर करेगा, if you do, गाली पड़ेगी. गाली is nothing but abuse, any kind of verbal abuse or any bad words. So otoacoustic emissions, that is OA, and abe. Abe is nothing but auditory brainstem response, and OA is nothing but otoacoustic emissions. That is done in less than 6 months, in children less than 6 months. Distraction test 6 to 18 months, or you can also remember ya with va instead. Okay, visual reinforcement audiometry, that is in 6 to 24 months, but this is not that important, so you can just let it go if you don't have time. 2 to 4 years old, speech discrimination. Discriminate mat kar, right? Kar is nothing but CR. So discriminate, speech discrimination, kar. Conditioned response audiometry. And greater than 4, pure tone audiometry, because usi pure tone mein you'll give the other guy the galis, right? So again, abe oe, distract या discriminate mat kar. Okay, अगर करेगा तो गाली पड़ेगी. So abe oe. Auditory brainstem response, otoacoustic emissions, are done in children less than 6 months old. Distraction test, or ya, you can just think of ya as VA. Visual reinforcement is done in 6 months to 2-year-old children. Discriminate, speech discrimination, is done 2 to 4-year-old. Also conditioned response audiometry, both of these are done in 2 to 4-year-old children. And pure tone audiometry, that is gali, will be done in children greater than 4-year-old. So this is how you can remember this. This is a small mnemonic with which you can remember all these hearing tests. Thank you.